What I'd like to do in this short video is show you how you can use block scheduling when your schedule is just chaotic and unorganized and not very productive. If you don't have enough patients, if your schedule looks like the one here in the picture, block scheduling is not what you need. You've got a different set of problems and need a different set of solutions. But again, when your schedule is unorganized and just crammed full of not very productive stuff, block scheduling can really help a lot. To try to make things a little bit easier for you, I've created a website, which is todaysdentalconsulting.com/blockouts. And there's a couple things on there. First of all, on the left-hand side, you can see what I call a cheat sheet. And you'll see those throughout this video. I think that's a better way to show you how to do things. The other thing that's on there is a link to the fairly recent Open Dental webinar on block scheduling, which is really helpful for the setup. I disagree with their philosophy about using block scheduling a little bit, but I think it's a very helpful webinar for you. So both those things, again, if you go to todaysdentalconsulting.com/blockouts, that's plural, both these things, links to both these things are there. So what is block scheduling and how do we use it? Block scheduling means you're reserving times in the appointment book for productive appointments. Now we're talking about appointments and not specific procedures, and I'll show you that in just a minute. This allows for the more productive use of provider time. Again, if you don't have any patients, block scheduling is not going to help you. I think one of the keys to successful block scheduling is don't make it too complicated. Keep it simple. Don't try to overmanage the appointment book by saying I'm only going to do crowns from 10 to 11 on Tuesdays. We'll show you a real versatile, simple way to do it, but keep it simple. We're going to create 3 different types of blockouts here. The rock time, which is any appointment with more than $1,500 in net production. Now I've got a question mark in there because your office, this threshold may be different, may be higher or lower, but $1,500 is a good place to start. Sand time is any appointment that's not $1,500, it's less than $1,500. And then hold time are for hygienists, for new patients, things like SRPs, where you want to keep some open time in the schedule. We're going to color code these different blockouts in the schedule. So we have green here for rock time, and then sand time is blue in the afternoon here. And we're going to alternate these. So on even days, like this is the 16th, then rocks will be in the morning and sand will be in the afternoon. On odd number days, in this case the 15th, we're going to have sand in the morning and rocks in the afternoon. So they're reversed. This way, any patient who's a rock that can only come in on Tuesday morning, if they can't come in on this Tuesday, they can come in on next Tuesday. So this is a very patient-centric way to schedule. We're not as dogmatic about the hold time for the hygienist, but you want to scatter some of these around in your schedule so you have a variety of morning and afternoon appointments available, particularly for new patients and root planing patients, things like that, where you want to get them in, you don't want to have them wait 6 months to find a hygiene appointment. Here's one of the little cheat sheets I was telling you about that shows you 1, 2, 3 how you can do these things. You right mouse click, you go to edit your blockouts, and then you can edit your blockout times over there on the right. And rather than say rock, we just put an R in there, and that's what's going to show up on the schedule. And then you can also set the color, and don't use real dark colors because it makes it too hard to read appointment information over the top of those. So light colors, in this case we're using green for rocks and blue for sand. In addition to the block types in the appointment book, we're also going to set up some appointment types in here. So you're going to go to Setup Appointments and Appointment Types, and we're going to create rocks and sand appointments types in here. Now what we're doing basically is just putting the color of the appointment in there. And I'll show you when you make the appointment how we're going to do this. There are no procedures attached to this particular type of appointment, and there also is no particular time. You're going to set those when you actually create the appointment. You can have other appointment types in there, for instance, a new patient that has both procedures and provider time pre-canned in there, but that's not what we're doing with these particular appointment types. So now when we create an appointment, we're going to pick the procedures there on the right-hand side, and you can see this doesn't add up to $1,500 of net production, so this is going to be a sand appointment. We're going to set our provider time on the upper left, the number 2, and then we're going to pick the appointment type, number 3 right there, and this is going to be a sandy appointment. That's going to make the background blue, and when you try to schedule this, that's a pretty stark contrast with the green of the appointment book. So it stands out. So we know this is not right. We want to put this blue in the blue section in the appointment book. When we schedule a rock appointment this time, you can see that's a bridge, so that qualifies as a rock. We select the procedures, we go over there, we select the provider time as we did before. In this case, when we pick the appointment type, we're going to pick rock. And you can see that is a green background, and so it shows up, we can see in the appointment book, yeah, this is in a green area, so it makes it easy to do this correctly. So when somebody makes a sand appointment and puts it in rock time, the color contrast kind of stands out. You can see that mistake. So we've got our rock blockouts, sand blockouts, and hold time blockouts in the appointment book, and we reserve this time until 2 to 3 days ahead. Again, depending upon how busy the office is and how easily you can fill the schedule. So we're holding our block time to 2 to 3 days ahead, and then anything goes. Fill the schedule. Forget the block time. 2 to 3 days ahead, I want you to fill that schedule with anything. So you don't hold this block time up until the day of the appointment hoping you can fill it. 2 to 3 days ahead, don't just ignore the block times and fill the appointment book. So we've been using this method of block time with our clients for 1,000,000 years, and this works great when people are handling the appointment book. But what do you do now with web scheduling? So with web scheduling, patients are allowed to make their own appointments. When I first heard this, I said, no way we're going to do that. And I was wrong. This works extremely well. So in Open Dental, this is part of e-services. And they really have 3 different features in here. One is the web scheduling for recalls, so patients can schedule their own recall appointments. We've been doing this for a long while, works really well, all the bugs are worked out, it just works. We suggest you turn your recall system over to Open Dental e-services. They now have some newer features in here where new patients and existing patients can web schedule, usually from a link on your website or from a QR code. For new patients, this works really well. People are getting new patients right from their website for essentially no cost. The e-services for the whole bundle, and you don't have to get the whole bundle, but the whole bundle is only $165 a month. And a new patient value is probably $500 to $1,000. So I mean, this is just a bargain. So your staff may be doing a great job with the scheduling, but they have kind of a nasty habit of going to lunch or going home at the end of the day. That's when the web scheduling takes over. It allows patients to schedule their own appointments 24/7. Your appointment book now is open 24/7. And just like we had rules for the staff about holding that block time until 2 to 3 days ahead, we need to have rules for the web scheduling. And I think you want to open that appointment book up for web scheduling anytime. In other words, web scheduled patients can schedule regardless of the blockouts. Now, this is my personal philosophy, but I think it works very well. You want to get those new patients in there. And actually, you want to encourage people to use the web scheduling because it takes some of the load off of the office. Now, one thing you want to be sure is any new patient that web schedules, they must have a welcome call from somebody in the office. Remember that new patients who've web scheduled have not had any contact with your office. You're basically just a presence on the internet. So you want to personalize this by having somebody call the patient. Say, hi, I just want to welcome you to the practice. I want to verify, we don't confirm appointments, but you can verify the time and the date. say, do you have any questions? I'm going to be sending you some new patient forms. Please fill those out so we can import those prior to your appointment. And great, I look forward to seeing you on Tuesday the 7th at 2 p.m. And my name is Bruce. If you have any questions prior to that, please give me a call. So blockouts are a great tool when your schedule is kind of jam-packed full of not very productive procedures and also just chaotic. And this works really well both with people scheduling, your staff, and also now with the web scheduling for patients. So if your appointment book looks like this, empty, block scheduling is not your solution. It's not going to hurt anything, but you want to get more patients into the appointment book, and that's a little different problem.